Good afternoon. My name is Amal Nirgudkar. I'm the CEO of Patient Prism, and I have here with me Dr. John Meis. Many of you know him as an international speaker, twice best-selling author on Amazon, and a phenomenal dental consultant who's ran DSOs, big and small, and now advises dental practices and group practices through two of his networks, Spark Dental Network, as well as Team Training Institute, which I'm sure you've heard about. Welcome to the show, Dr. John.
Thanks, Amal. It's always great to be with you.
Thank you. And we yesterday we talked about reducing the burn rate as we are in. I mean, the coronavirus crisis has kind of almost crippled us a little bit, at least in the short run, with our cash flow. And so one of the things that we talked about yesterday was how do we cut expenses and reduce the burn. And today we had teased it a little bit yesterday about let's talk about a revenue cycle. Let's talk about things that could potentially make us money even during this time. And I was intrigued by the topic, so I said let's do our today's update on increasing or maintaining revenue cycle activities during this time period.
Sure.
So I'm excited to talk to you about that. So tell me, what can practices do now to keep their collections going, if it's even possible?
Sure. So what happens frequently when there's a crisis like this is practices become somewhat paralyzed. And so they start to not do the things they normally did. And so one of the things that we want to make sure that everybody does is they continue to work their insurance AR. Second is they think differently about over-the-counter collections. Most offices are providing some emergency services.
Okay.
And then third is get creative. And I'll tell you about a couple of things that I know practices that are having success with.
Okay.
So those are kind of the three things I want to focus on.
So the first thing you said was insurance or work insurance AR. What do you mean by that?
So the systems that make sure that we are getting our insurance AR really should be continuing to happen, whether that's somebody in the office or somebody working remotely, doesn't matter. But we want to continue that cycle. So that is daily. Insurance claims for any treatment done are being submitted, right? And we're checking whatever insurance processor that you have or clearinghouse that you have to make sure that the claims are going in clean. Just like any other time, don't stop that. There may be less volume, but it's not no volume. And every dollar is going to matter as we go through this. So make sure that we're doing that. And then the next is the follow-up. And our process for following up is day 15. If we don't have payment, we are contacting the insurance company, either online or by doing a phone call. And we're asking them, did you get our claim? If they say yes, we're going to say, great, when can I expect payment?
Sure.
And tie them down to a date. If they say no, great, now I know. Now I can resubmit the claim. So that every day that you're going back 15 days and then you're going back 30 days, right? Because if they promise you a payment, they say we got your thing, it's coming. If you don't have it 15 days later, right, you should be, again, calling them and getting on them. So one of my fears, Amal, with this entire crisis is that as companies are told, as employees are told to shelter at home,
Right.
what's going to happen to the payments coming out of insurance companies? And I frankly thought it was going to absolutely crawl to a stop. That's not what we've experienced so far. In my own offices, we're getting our insurance payments really at a normal pace and a normal amount. We haven't seen an effect. My practices are in Oklahoma, and we have not seen that has been an effect. Thank goodness. And so we want to make sure that we, as those payments come in, that we make sure that they're hitting the bank. So if they're electronic drafts, okay, great. They're already in the bank, perfect. If they're not, if it's a check, we're making sure that we're getting those to the bank every day so that we keep that cash cycle going. So number one, make sure you're following up with insurance companies. Number two, make sure that you are getting it into the bank. So go ahead.
So quick question. So your insurance coordinator, although they may not be doing as much activity as they normally did, they still have a good amount of time they can spend on a daily, weekly basis to follow up, obviously on the current AR, but also what about past stuff, right? Past 30 days.
Yep, that's what I'm going to get to.
Okay.
Great question. So that cycle of going through works really great for 15, 30, 45, 60 days. If you have stuff that's out past that, you may want to just consider it a block resubmit, where you resubmit all the claims that are longer out there, rather than try to follow up on everyone. There's a reason why they haven't been paid. Let's do a resubmit. It's amazing, Amal, when we look at practices, insurance AR, and we go in and get down to the individual claim, we'll see claims that are stuck in their insurance AR that the claim was done 3 years ago, right? Well, now you're not likely to get paid on that, but at least if you resubmit it, now you're back on your 15-day cycle, and you'll find out soon enough whether they're going to pay it or not pay it. Most insurance companies don't pay those really old ones. Most of them, if it's more than a year, you're not going to see payment. Some of them even less time than that.
Right.
So, but it never hurts to just do a block resubmission, and that way it gets into your current AR work cycle.
And now that we have extra time on our hand, right, because we're not as busy, it may give us an opportunity to look at our insurance collection process,
Yep.
our write-offs, our charge-offs, whatever that might be, and bring that percentage, and seeing, even if we don't get paid on the past ones, at least we say, okay, this is the mistakes we made, or this is the change we can make to our process to submit them correctly. I think we could significantly improve the process when we come back on full steam.
Absolutely. You're going to learn a lot by going through the process. And so some practices just laid off all their employees. And this is, I don't think that was necessarily a good move with what's going through Congress. They're battling on it again today.
Right.
You know, it may be that wasn't necessary, or wasn't the wisest move. We'll know, you know, as the next week goes on. But this is a critical function, and most practices now are going to have a payroll they're going to have to pay. And remember, most practices are paying yesterday's bills with today's dollars. And if there is no today's dollars, there's going to be a cash crunch. And so we want to make sure that we're getting every bit of cash that we can get in, and this is how to do it.
So the second thing you said earlier was over-the-counter collections, and how we can improve over-the-counter collections. Again, tell me what that means and how do we do that?
Sure. When we're off our usual game, some of the habits that we have of collecting money over the counter just fade away. You know, patients are coming in. The ones that are coming in are emergency patients. Many of them are in pain, and in some way or another. And sometimes with that class of patient, because they're in pain, we just don't really deal with the finances right then and there, right? We're dealing with their pain, not so much their finances. This is one time when I would change that. And I would definitely be asking for full payment.
Sure.
Even if normally you just ask for the patient's portion, I would settle for the patient's portion, obviously. But I would ask for the full payment. There's no reason not to. If their insurance company pays, you can always send them, you know, a refund. So I would ask for the whole thing again, just so that we keep as many dollars, because it's going to get tight. If it's not already, it's going to get tight for everybody.
So maybe have a process in place, a new check-in process. Emergency patient walks in. If they're a new patient, they fill out whatever they fill out, provide a credit card, and maybe there is a new cadence that you apply now during this time, so that you're collecting everything up front, and there is no, after the emergency is gone, there's no argument about what happened and what's owed.
Yep.
So
I totally agree.
I think all practices probably need to have probably a new program in place to handle what's going on currently, because obviously, if you are now, your rhythm changes, right? And there's a brand new rhythm that you need to get used to, whether it's collecting money or submitting claims, whatever that rhythm is. Maybe you need a little huddle in the morning with the team that you have, You say, hey, this is how we're going to do this today. And including rhythm like, okay, patients in the parking lot waiting, we're not going to let them in until their appointment, they're ready to be set.
Right.
That's
Yep.
the rhythm, right? So maybe do you recommend like a playbook for this time, just little one pager cheat?
Absolutely. So, and you can look at your current documented systems, which not very many practices have, frankly. Dental practices tend to function on tribal knowledge, right? A new person comes in, somebody trains that person. It's one-to-one. There is no written down systems, which is another great activity to be doing right now. Is what
Absolutely.
is our normal way of doing this? Let's document it so that we can teach new people, we can bring them up to speed and onboard them at a much faster rate. So documenting these systems, but you may have a separate document for right now. This isn't what we're going to normally do, but
Right.
right now this is what we're going to do. So we're going to answer our phones differently. How do we answer our phones? People are going to ask us questions they don't normally ask. How are we going to answer those questions? So having those little mini systems that are temporary is really going to be helpful for the team. That way we have a consistent experience with our patients. So some practices that are keeping a skeleton staff on board to take care of emergencies, well, they're moving that around to different people, right? So so the patients, the person that's working today may not be working tomorrow, may not be working the next day, but we know that patient trust is improved by having consistency. So if we have these little mini systems in place, we know that the patient's going to have a consistent experience regardless of who's sitting there.
That sounds amazing. I think systems are what you teach a lot, especially as practices scale from 1 to 2 to 5 to 10, and you need that consistency. So,
Yeah.
so something that you preached really well for a long time and implemented that in your clients. The third thing you said, I didn't forget, which is get creative during this time. We're talking about revenue cycle activities, maintaining that rhythm of collections.
Yep.
And we talked about insurance AR, we talked about over-the-counter collections, but how do you get creative? Because that excites me, because like creative is something that I crave.
So multiple ways I've seen practices do it. So one of the things that I think has had a profound impact for the practice that I know that's doing it is they are contacting people who had scheduled, right? So these are people who had some treatment recommended, they decided to move forward, they'd scheduled it, and now we have to reschedule them out because it doesn't qualify as emergency treatment or urgent treatment. So we're having to reschedule those out. So if they have not prepaid, it does make sense to offer them the option of a prepaid discount. And so the practice I know that's doing this is calling those patients that were scheduled and saying, hey, here's an opportunity. We're trying to, we're closed. Our cash flow is low in this unique time. We're trying to, make sure that we have some money to make sure our employees are taken care of. We're offering, in order to get that, we're offering this prepayment discount. And so, so they have had 1 in 3 people that they have contacted gave them a prepaid for their treatment. So,
Well, even though the treatment doesn't happen now, it could happen in May or June.
yep.
But we're saying that, by the way, your treatment plan for this crown was $1,200, but we're gonna make it for $900 right now if you pay it.
Yep,
So
you prepay. Yep, exactly right.
that's
So
a
that's
great.
one way I've seen people get creative.
Okay, prepayment.
Prepayment. Yep. Another way is an offer of discounting people with a balance. So calling people saying, hey, we're trying to help everybody with this coronavirus. This is one of the things that we're doing to help our patients get through this. Is we've got a discount for people who pay right now. Maybe we'll take 70 cents on the dollar on stuff that's owed to you. The people that have done that has not been 1 in 3. It's been about 1 in 6, but that's better than nothing. And so every dollar that comes in is pretty important.
But you got to be careful though, right? Because people are undergoing a lot of stress.
Yes.
And if they've lost their job recently, they don't want anything to do with
for sure
doing any of that stuff.
Yep, for sure.
So
we can't assume that everybody's in that position, and that's I think what we tend to do is we think because some people have a money issue, other people, we think everybody has a money issue. No,
Right.
some people don't have a money issue. They're continuing to work, or they have their own resources. They're not worried about money, and a discount would sound attractive to them. So this is just an offer. If you don't want to do it, that's fine. But we're offering this opportunity for you, and those that take it, great. Those that don't, but it can't seem like a demand for payment. Right.
Correct.
So
It
that's
kind of sound
really
like
where you want to stay away from that. This is just an opportunity for you, patient, to save some money. And I think if you stay on that side of the line, I think you'll be okay.
wonderful. What else? What else can you get creative about?
The other thing that I've seen practices do, which I've seen practices have gift certificates, gift certificates, and often people will do this at the end of the year as stocking stuffers that, oh, my wife wanted to get something done. I'm just going to get a gift certificate so we have a stocking stuffer, or parents to their kids, or kids to their parents, whatever. It's a holiday strategy usually, but this is a good time to pull it out.
Right.
And again, $100 a treatment for $80 or $70 or whatever it is. So that's another option that I think can be deployed right now. Are these going to be, home runs, big dollars? No, but every dollar is going to count. So I think it's worthwhile doing.
Absolutely. I mean, I think any amount of revenue is going to pay for something that you cannot cut. There is utility bills that you got to pay. You collect $1,000, and maybe the phones and the utilities,
Yep.
whatever they are. There's not going to be everything that you can negotiate down, and if it can pay for that, at least it minimizes that burn again.
Exactly right.
That you're doing. I think communication is probably going to be the key in this, right? In how you communicate this with patients.
Yep.
Without you want to be on their side. And you also want to tell them that, hey, we're trying to keep our amazing team that you love. And in order to do that, this is what we're willing to do. We've got now, since yesterday we spoke, we've got Congress pass this legislation, $2 trillion and
Additional.
added, and it's a lot of money. We don't know how long it's going to take to do this, but
Right.
But you do believe, right? I was pretty encouraged by your thought process, is that this is going to be a decent amount of push in the economy, and it's going to really give a big jolt.
Yeah. So all the stimulus is so far. I heard President Trump say yesterday, $6 trillion. Hundreds of billions of that dollar going directly into the hands of consumers, right? Very different than the bailout from the real estate and bank mortgage crisis. Very different than that. This is dollars going into people's hands that they can use to spend.
Right.
I saw this morning one of my financial advisors is recommending buying gold because he's concerned about hyperinflation, that
Absolutely.
all this money is going to be inflationary. And because it's so much and being injected so quickly, that we may go through a period of hyperinflation. And so it will be a huge shot in the arm. And so other things that have affected the dental industry significantly, this really is very different. When we think about, there was a time when HIV was emerging that there was a transmission in the dental office that created a lot of fear, and a lot of people didn't go in, and dental practices saw significant dips at that time. Well,
Right.
this is a disease process, but it hasn't been related to dentistry in any way.
Right.
Dentists are not open so that we're saving the personal protective equipment for hospitals. So it's
Right.
not like people are afraid of transmission in the dental office.
Right.
And so I think when this passes, that dental practices are going to be swamped. So I think there's going to be a lot of demand, and people are going to have money they're not used to having.
And there's going to be some supply constraints at the time, right?
There sure will be.
And I think that's going to be a great topic for us. Maybe the next time around, talk about gearing up for this supply as things get better, making sure you're prepared for this, and maybe you can recover all these losses that you've had, but you have to be able to be available, and you have to have the open chair time in order to do that.
So we're advising dentists to tell their teams that when we come back, it's going to be a different ballgame. We're going to be having to work 4 hours. So this expansion of hours and days, while we catch up, most teams are going to be pretty happy with that, because most teams are financially negatively affected by this whole thing, and this is going to give them an opportunity. Some of them are get some overtime. So allow our teams to catch up, allows the practices to catch up, at least partially, so do what we do.
No, agree. I mean, agree with you 100%. I think we're definitely, the comeback's going to be pretty strong. No, this has been great talking to you about revenue cycle activities. I think you're right. The paralysis happens because you're bombarded with so many problems at the same time, and it leads to inaction.
Yep.
You just want to just give up and just watch the news all day or something like that, or watch Netflix, and you kind of don't want to do anything. But I think your three things are spot on. I mean, you gotta work your insurance AR, make sure that you're getting paid on every dollar. If you've gotten rid of everybody, make sure your insurance coordinator, whoever handles insurance, is following up every 2 weeks, making sure all the dollars are coming in
every day for 15 days ahead of that. So you're following up every single day, following up on those outstanding claims.
And then definitely with your emergency patients, if you don't have the system already of collecting payment upfront, hopefully over the counter, you don't want to get into this situation with the patient that, oh my God, the crisis is there. How should I ask them for money? Obviously, you have to keep your doors open, and you need money.
And if they can't pay, then you have a decision to make. Do I care for this patient because they're in an emergency? You have a decision to make, but you at least should ask, right? Because some are going to be in a position where, sure, I'll pay the whole thing now.
Right.
At least ask.
Absolutely. And then it doesn't hurt to be creative in any circumstance, right? You've said offer them a discount for prepaying, even though the appointment is further down the road, and tell them the reason why. Be honest with them and telling them, hey, we would like to keep our team, keep our lights running, and pay our bills. So in order to do that, we're giving you this prepayment discount. Yeah. You also talked about some gift card type scenarios. Those were excellent. And really give these patients an incentive, especially, or even the older people who owe you money, they have balances, 60 days, 90-day balances out there. Yeah. Tell them, hey, we're going to give you this option during this crisis because we want to, same reasons, obviously those are the same reasons, and try to collect as much as you can, even if it's small, even if it's 5,000, it's 10,000, it's better than zero. And it allows us to sustain during this time period.
Yeah, that's it. So everybody's kind of in the same boat. Everybody, we're coming up towards the end of the month. A lot of payrolls are going to be paid. Cash is going to get tight. I think based on the transmission of the disease, the American Dental Association is probably going to, their 3-week emergency only probably is going to be extended. Yes. And so every dollar counts.
Absolutely. This has been a great discussion. Thank you, Dr. John, as usual, for your wisdom. If you need some resources about this, Dr. John has an amazing website, the Team Training Institute. The numbers are on the screen and the website as well. Check them out. There's new updates every single day. They've done an immense job at actually looking at data across different websites. Contact him. He will get back to you and give you and guide you at least in the right direction.
Sounds good. Thanks, Amal. Always good to be with you.
Absolutely. Thank you.